We're taking a live look at Montreal for you this morning. And as we bring you the ongoing coronavirus coverage, of course, we don't lose sight of the science and what researchers around the world are looking at in terms of understanding this new virus, working toward treatments, working toward vaccines. There are Canadian scientists very much involved in this critical exploratory phase. And as we look at Montreal, a pretty exciting story to tell you about this morning about what researchers are launching today in terms of testing a new treatment. Dr. Jean-Claude Tardif is the director of the Research Center of the Montreal Heart Institute. He's the professor of medicine as well at Université de Montréal, and he's my guest from Montreal to talk about a big recruiting drive he's launching as of today. Dr. Tardif, welcome to our program. It's a pleasure to meet you here, sir.
Likewise, thank you for having me.
I said it was pretty exciting. I should let you tell people what it is that you're actually launching today.
Yes, we are launching a large clinical study of 6,000 patients to try to prove that reducing inflammation and basically modulating the response of the immune system in patients that have COVID-19 would reduce the risk of complications that are mostly lung-related.
So looking at that, that's what you're seeking to prove, and you're going to be using a drug, something called colchicine, that's in other common usage elsewhere, but tell us how you think it could be used in fighting this coronavirus.
Yes, so colchicine is a powerful anti-inflammatory agent. Actually, it's been around for centuries. It is used mostly to treat gout, or another viral infection that is called pericarditis with quite a bit of success. We've actually shown just a few months ago, and we published in the New England Journal of Medicine, that when given to patients after a heart attack, it was actually reducing the risk of cardiovascular events. And now because we believe that the complications related to COVID are by and large related to inflammation, we're using this inexpensive, widely available drug in trying to reduce the complications, including death related to COVID.
Those are some of the really positive benefits from this, as I understand it, that it is so widely available and that it is inexpensive as it would be in wide usage given the kinds of numbers that we're seeing. One of the things that stood out for me as I was reading what you were doing is this whole notion of targeting the inflammatory response sort of came about from what you were seeing in children, Dr. Tardif.
Absolutely. Actually, if you look at the common denominator between what happened in the Spanish flu pandemic of 1918 and what's happening now, currently with COVID-19, what is really children who are infected actually do not really get complications of the viral infection. And so one of the main differences between what's happening in children and adults, children are able rapidly to sort of put the brakes on the inflammatory process, if you will, and we actually have some clues as to why they're able to do that. And one, and second, we know that at least for some of the patients who actually died from the Spanish flu or are seriously affected by COVID right now, what we learned from China and Italy, actually, they have what we call the inflammatory storm, and what in science we call the cytokine storm. And so we believe that by preventing that from happening, we may very well prevent significant complications from happening.
So using that response in children, using this widely available drug, this colchicine drug, off you go with these clinical trials. So you're looking at, you said the number, 6,000 Canadians can apply as of today?
That is correct. The study was launched actually an hour ago. We have 40 nurses who are available in the hotline 24 hours a day to answer the questions, to make sure the patients are eligible, and then they'll be able to sign the consent form electronically, and then we'll deliver the drug to the patient home within a few hours, and then the patients will be able to start, and we'll follow them through the internet, FaceTime, Skype, our hotline, and so forth for the next 30 days.
And these are people, obviously, who have already tested and been confirmed as positive. You're looking in terms of taking part in this to see if this drug is an effective treatment in reducing that inflammatory response and in reducing some of the complications. It's pretty amazing. It's already underway. You're going to staff this around the clock. You're looking for big, big numbers. The speed at which your research project has taken off and is already now out with humans, that's pretty unusual, isn't it, Dr. Tardif?
Well, I honestly think that it's a first in the world. Everyone has worked so hard, from Health Canada that reviewed the protocol over 24 hours instead of 30 days, from CGI that produced the electronic system to help us reach 6,000 Canadians, TELUS that put all the hotlines in record time, the 125 people in Montreal, that pharmacists, nurses, statisticians, epidemiologists, virologists, immunologists, intensive care docs, and so it is quite amazing when human beings want to work together for the greater good, what can be accomplished.
It is very impressive, and especially so that it's happening here in Canada. We'll be following along with you as you go through this 8-week trial. We'll check back to see how your patients have done and whether or not this is, in fact, a key to treating COVID-19. Thanks, Dr. Tardif. I appreciate it.